Now, before I move to listen to heart and lungs on your back, I am going to palpate your thyroid, and then I'm also going to listen with the bell of my stethoscope for any bruise over your arteries. If you will, just swallow for me. Okay, and this patient's thyroid is palpable. It's symmetrical, nothing abnormal, no lumps or bumps noted. Okay, and if you will, just hold your breath for just a second. Okay. Okay. No bruiser noted. Okay, if you will, just come around to. Okay. And if you will, just take a deep breath for me. Okay. Deep breath. Okay. Deep breath. Okay. Deep breath in and out. Okay. Deep breath in and out. Okay. Deep breath in and out. Good deal. Sounds good. Lungs are nice and clear. What I'm going to do now is, if you will just come around to this side, I am going to, with indirect percussion, I'm going to percuss. Okay, now I have the melodies noted. Okay, if you will, just come back over here for me, and I'm going to have you to lay down. Okay, and what I'm going to be doing now is I'm going to listen to your cardiac sounds one more time because they may sound a little bit different. I'm also going to listen with the bell of my stethoscope to your cardiac sounds or your heart sounds, and then I'm going to do an assessment on your abdominal.
Okay.
Okay. And something else I would like to add, obviously, for the patient's privacy, I am not uncovering her, but in a real situation, you would always want to make sure that you listen to the cardiac sounds, lung sounds, anything with your stethoscope on bare skin. Now we're going to be listening with the bell. Alright, and now I'm going to move down to her abdomen. We're going to listen for bowel sounds, and then I'm going to palpate and percuss the abdomen. Okay. And also, something else that you can do while you're listening for bowel sounds, you can also be assessing with your eyes the abdomen. Does the patient have any bulges that might indicate any hernias? Do they have any in the abdominal aortic region? Have they been having any severe ripping, tearing pain that might lead us to believe that they've got a AAA, anything like that? Right now I'm going to feel of your abdomen. I'm going to start out lightly, and if you will, just let me know if any of this hurts or if you're tender anywhere. Okay, I'm going to go a little bit deeper. Right under here, palpating the patient's liver. If you'll just take a deep breath in for me. Okay. Okay, that's great. And right now I'm going to listen for bruise over the arterial areas. Over her kidneys. And the iliac crest. Okay. We would also want to palpate lymph nodes. And also while you're palpating lymph nodes, you can also see and check for femoral pulses. Okay. All right, I'm going to get you to go ahead and set up for me. Okay. Now what we're going to do is, if you will, what I'm going to do is I'm going to check for reflexes. And what you would normally do is have a reflex hammer, but you are going to hit in this region. Okay. Okay. Let's see. I'm also going to palpate pulses. Okay. Nice. The pulses. And obviously you would palpate pulses without clothes being on. You're going to do that to the bare skin versus trying to palpate through clothes. Okay. And let's go ahead and test strengths. If you will, just kind of set up for me, okay? And I want you to shrug your shoulders, okay? Raise your arms, okay? Lower them down, okay? And then if you will, just pull, take my hands, okay? And pull my arms, okay? All right. And then can you push on my hands, okay? All right. And now what I'm going to do is I want to take this foot right here. If you will, just push on my hands. Okay, there we go. Push on this hand. Okay, let's do them both at the same time. Okay, good deal. All right. And let's see. Okay, what I'm going to do now is, if you will, just close your eyes for me. And I have got, and if you'll just keep your eyes closed, I've got an object, a familiar object, I'm going to place in your hand. If you'll just tell me what you think this object is. Can you tell what that?
Ink pen.
Okay, pen. Okay. And now what I'm going to do is I'm going to see, I've got a sharp object, and then I've also got a soft object. If you'll just keep your eyes closed. I am going to rub one of the objects across an area of your body. If you'll just tell me whether it's sharp or soft and where it's at.
Soft on my cheek.
Okay. Okay.
Oh, that's kind of soft too.
Okay. What about this?
Yeah, that feels soft too.
Okay. What about this?
Soft.
Okay. What about this?
That might be a little, it's not real rough.
Okay. And where is this at?
On my arm, my forearm.
Okay. There we go. Alright. If you will open your eyes, And let's go ahead and stand up for me. And what I want you to do is just walk out a little ways for me. And we're just assessing her gait, which is normal. Okay, stop. And then if you will, just try to bend over. Okay, and we're checking for any scoliosis or asymmetry. And do not see any. Okay, you can stand back up. Okay, and then go ahead and let's walk out a little bit further. Okay, and then turn around for me. And on your way back, can you walk on your tiptoes? Let's go ahead and walk on your tiptoes, okay? And then can you walk on your heels? Okay, now let's turn around again. And now I would like for you to walk from heel to toe.
I don't know about that now.
Okay.
My balance ain't that good from heel to toe.
Okay. Now, before I have you to sit back down, if you will just come back over here and turn around for me. And I'm going to have you to close your eyes. And we're checking for any swaying. The patient does not have any swaying. Okay, you can open your eyes. All right. Thank you so much. And that completes the head to toe assessment.